So thank you so much for asking me about what a clinical intervention is when someone's in treatment, because everybody always thinks interventions are outside when really they can be inside. Probably the most common type of clinical intervention we see is someone has been in detox and then they came to the treatment center, and then about a week later they say, you know what, I've had enough. I think I'm gonna leave. And sometimes in the treatment center that's left, which is so funny because we know with addiction that it takes a group to intervene in the beginning. There may be a one-on-one conversation with a clinician trying to keep Johnny or Sam or Sally there from leaving. But there's a better way to do that, and that's when you bring in a team. And the team consists of whoever the appropriate professionals inside the treatment center, plus mom, dad, husband, wife, and if there's an interventionist that's used who has a consent form signed, you bring them in. And so once again, you have this conversation going on where there's healthy boundary set. It's run from a place of love, compassion. Like, I'm so happy that you're here and I see the progress. And you know, mom and dad and I will only support you staying. Another type of clinical intervention that I know that I have done and have done with my colleagues is you can have someone, and a lot of times people have been in many treatment centers, let's say, and there's a point where in the treatment, new issues evolve. And I think of one wonderful client that we had who had been in 7 treatment centers before he was in this one, and he really had done quite well. He had already been there for 9 months to a year. But one of the things that always seemed to take him back into relapse, were females. And he was starting to engage, because he was already having privileges, to engage with females in an unhealthy way. This is really interesting, and so the young man really had relationship or attachment issues and really needed to be seen by someone who was, professionally trained in that area. And so what we did was we came in, my teammate and I, who did the intervention together, we met with this young gentleman with the clinicians of record, 2 clinicians there, plus we had mom and dad who lived far away in the Midwest on the phone. And here's a young man who had already he's got 9 months of recovery, 10 months of recovery, and yet we just knew that this was his trigger. And so we did a clinical intervention inside. And that's the beauty of clinical interventions. You bring together the community. And again, I find it interesting. We know with substance abuse and early recovery that people work better in groups, that the power of the group helps you change, and that if you go one-on-one with someone, you're not as successful. And so it's just a variation on that theme. And clinical interventions can be done numerous times. It's just a matter of collaboration, of openness, and of taking that look and pausing and saying what's in the best interest of this client.